Today's guest has a strong background in healthcare and business. Jennifer has dedicated her career to empowering teams, driving transformation, and fostering inclusive environments. Her passion for mentorship and continuous learning has made her a sought-after speaker and collaborator. Whether leading projects or inspiring others to reach their full potential, Jennifer brings energy, insight, and a commitment to making a meaningful impact. Please join me in welcoming Jennifer Taylor.
Hi Jennifer, how is it going?
Well, how are you?
Very excited for today. How is it going?
Well. Yes, happy Monday or
Yeah,
Tuesday.
happy Monday. It's the start of the day, and for us, we came from holiday. It was our Eid as a Muslim. So yeah, I feel very fresh and excited. So today, I'm excited. You are joining me, Jennifer Taylor. You are a leader in healthcare strategy and prevention and innovation housing solution, and also you work about addressing the root causes of health and well-being, not just as a symptoms, but you try to find the root. And I am very excited to get into our discussion for today. So today we have some, let's say, is uncommon topics to discuss, especially among the healthcare. So can you please give us a brief before we get started?
Sure. So, really, what I wanted to bring up today is strategies on prevention, and there's different tiers to it. And where I'm coming from is around tier one prevention or primary prevention, and we can go into it a little bit more, but how that correlates and how I look at it from a housing standpoint and co living, and how that can help stabilize communities and help our healthcare system ecosystem.
Absolutely. So, first of all, how did you get first involved in co-living overall? Was there any particular experience or experiment that sparked your passion to do that? One background I would give for my audience. Okay, so you came from non-clinical background. You are engineer. You study engineering, and you have that passion to do and to speak more about the co-living and co-housing. So give us more context why.
It's a good question. So, as an engineer, I wanted to indirectly help in healthcare. So, to me, I grew up around it, had family nurses, other clinicians, and so I was around the hospital environment. And I went into engineering, and instead of widgets, I really wanted to help patients. I felt like a calling, and so indirectly, as an engineer, I help with strategies, operational work to support the clinicians and the greater good of the hospital. So, where it came up for me is specifically when I got into organ transplants earlier in my
Mm.
career. So, I helped as a consultant, later on became a leader over an organization of organ transplants, and then continued on in consulting as well. But what I saw was a lot of the people and patients that were coming in, they had these social determinants of health issues that created instability in their life. And one area was housing. So if they didn't have stable housing, it was hard for them to be able to show up to their appointments. It was hard for us to be able to follow up and find them, right? And even get them into the system for a transplant, the workup piece of it.
Mm.
So that up front really taught me that there's so many different ways that we need to look at the healthcare ecosystem and what our patients are going through. And once I kind of figured that piece out and started to look into how I can help, even further than just being a part of the system, the healthcare system, I found this co-living model. And it was something that resonated with me because I could help indirectly and also directly with housing instability. And I found that that really does help stabilize people and connects them back to the healthcare system.
Yeah, lovely. Very interesting. Very interesting. And before we get more deep on our discussion, I would like just to share with my audience, and I will give you the floor to give more context about that. You manage and you have your own initiative for that, and you have your own group in your town. I think in West Bay, if I'm not mistaken, in LA. So can you give us more context about that, what you are doing, and how? Because now we understand your passion, but you take
Mhm.
it very seriously and establish your own organization or NGO supporting this vision and mission you have in your mind.
Yes, thank you. And thank you for allowing me the space to be able to share with others. So, for me, what I wanted to do, I'm an engineer. I wanted to experiment how I can make this happen and how I can connect the dots for people. So, I really had to research a lot around co living. So, what is co living and affordable co living? So, basically, it's investing in a house, a duplex, triplex, whatever it is, and breaking it into parts of you have your bedroom space, which can be contained, right? So if you can provide locked doors, they can have their own access to that. And then from there, there's shared space. There's bathrooms, kitchens, dining rooms, backyards, and even parking spaces. All of that shared space. And that's what creates a co living environment. And you can make it more affordable for people because they're renting it by the room. And it's different from Airbnb and other things because they're staying there. It's stability. So they're staying there for a portion of time. Could be 6 months, a year, until they get back on their feet or until they can afford maybe a down payment or rent security deposit. So that's what we're trying to build, is a healthier community where people can come together, have a good solid roof over their head, and then from there create a life and stability in the community, which then hopefully they can move on in, whether it's 6 months, 2 years, to their own space, or being able to afford maybe even a house of their own. It just depends.
Yes, lovely, lovely. And for my curiosity, from your experience, what is the most cases you have used or resident on your co-living project and pilot? So, do you have any trends for certain population or certain disease they came and sit on your project?
So the way that I look at it, this is a tier one. So this is helping them just with a roof over their head. So I look at it as Maslow's hierarchy of need, prevention as far as keeping them out of homelessness, keeping them from being transit all over the place. So for me, I've set up, a model where they can have this house, rent out the rooms, and create their own environment. So that's kind of what I have established so far. And it's my first experiment. It's not directly to any specific disease state or type of person. It's who needs it in the community and who's working in the community, whether they're working at a hospital, they're working as a librarian, a teacher, whatever it may be, or even at a coffee shop. It's creating stability and getting them into that community more.
Okay, I see. So, what make it different from the traditional housing options?
So, first of all, it's more affordable the way that we're slicing it up and renting it out by the room. And they're furnished rooms. So they have a bed, desk, uh, bedside stands, closet space, and all of that. But it's affordable to somebody that's only working a minimum wage job or maybe just
Mm,
making a little bit over that. So that's how it changes from, let's say you're renting a one bedroom, right? You have a security deposit, which sometimes can be a lot for a person. And then on top of that, that monthly amount is more than what they would be paying for a month in a co-living situation.
okay. What is about affordable co-living that excites you the most?
So to me, it's just creating space in the community because we need all different types of people to support, the local shops, the libraries, the hospitals, all of that. So it's giving this affordable space near maybe a large city or a smaller community, but just bringing people into that space so that they can find their community and then connect into the healthcare system, connect into the local services, whatever else. So it's creating that stability, that connection, and the community. So that's what excites me about it.
Yeah, very interesting also, and yeah, I see the value from that. And here, why do you believe this is very important for our communities and our future healthcare system?
Well, to me, it's all about stability, connection, and community. So those three words kind of keep on coming up to me. And, for the linkage directly into the healthcare system, our patients and people in our community need us. And if we're not able to find them, or if they're moving around a lot, there's inconsistencies in what they're able to receive from the healthcare system. Maybe they're switching providers if they're moving around a lot, or it's just hard to follow up and to find them. So, to let's say somebody that maybe is on the tipping point of diabetes or something like that, it's going to be hard on them if they don't have a consistent healthcare system, a consistent community of support for them.
Yeah, my next question was how it's connect with the healthcare, which you answered already. But do you follow any framework or grade you can show us and straight and to understand more about that?
Yes, there's actually, and I'll share it as well, but there's three tiers of prevention. We call them the strategy models of prevention. So, tier one to me is really around the social determinants of health, the stability, and it's being proactive around the support that we're providing to the community to keep them, to deter basically disease, right? To keep them healthy. And that's tier one. Where tier two, and that's the place that I'm working in, where tier two starts to get into early detection, early screening, things like that. So once you have that community, stabilization, then you can connect them in for prevention and making sure that they're getting screened timely and getting the care that they need. And then, of course, that develops into, if something is detected, the tertiary prevention, which is disease management and getting into complication avoidance. But again, I'm at the primary level and trying to help advance that area and help stabilize. Just one of the components is housing. There's many others, right? When you talk about social determinants of health and community, you can get into food insecurities, you can get into environmental things, income disparities, all of the different areas. So I'm just trying to pave a way in one of the aspects that can help the community.
Yeah, and you mentioned as a social determination of health, which is as DOH. It is the primary and sorry, it is the tier one, and we keep hearing this term a lot and a lot recently. Can you explain what that's mean with more depth and context about that? I know you just touched base with that, but why
Mhm.
this is as crucial for housing and co-living also with the health. So if you can give us more context, what is the social determination of health?
So, really, when we look at social determinants of health, it's really assessing. So, to me, um, some organizations do this, but it's a screening of anyone that's coming in to make sure that they have stability, right? They have what they need to thrive in the community. The income level, so they might not have a job right now. Healthcare insurance, access to what they need, food, and then housing, environmental areas. All of this creates a community and sets up the foundation for everyone in our community. So it's just a component of looking at, I think there's 9 different areas of what helps create a person's stability in their environment. So to me, it's just one way of looking at what are the barriers for some people in the community and how we can help them. Does that help?
It does, and there's a lot of work need from different stakeholders to make this happen. And this is what let me ask you because I want to see from your experience, why do you think healthcare professionals should care about the affordable co-living?
So to me, it's one of the social determinants of health. So it's something they should know about their patients, what they're going through, what barriers to access different components, right, in the healthcare system. Because if they're not able to have a stable house, it's going to impact the relationship that you have with them, right? Trying to find them and all of the other things. I also feel like when we look at this, there's so many different areas around trust and creating that stability and trust in that relationship, and also tailoring your care. So if you're listening and hearing and picking up on different things, you can help support them in other ways or link them into community support. And what I'm trying to do is say that once you can screen and assess for that as a clinician or a care team, it's good to know that co-living, and there are options in certain committees that are communities that provide this for people.
Okay, so what role can they play in making this model successful?
So for me, it's all about understanding what's available in your community. Not every community has this available, right? So it's understanding, is this available, and is this a community based resource that you can provide to your patients or give them an introduction, right? A referral into. So that's kind of the way I look at it. One other thing that I wanted to bring up from a clinician's mindset, there's also this component of housing stability can help with reduce the usage of EDs, right? If they're homeless or not in a good environment, right? There's studies that show there's a linkage to increase in ED use. There's also just the management of any kind of, maybe if they have a current health concern or chronic disease or starting to work their way into it, it's going to be poorly managed if there's instability in housing, or it can be because of their being, you know, not stable in their environment. And then also missed appointments. So that's something else to think from their standpoint. If they're not able to have a roof over their head, it's going to be more likely for them to be missing appointments because they're not stable in their community and environment. So that's something for them to think about and assess up front.
There is no doubt this is very important and essential to be considered, and is part from our care plan, and this is what we use or what we thought in the school. But in reality, I will give you on
Mm-hmm.
behalf of the clinician, we every time complaining of from shortage, high volume of patients. So clinician, there is shortage in physicians, shortage in nurses, and with the high volume. How you think? Okay, this is will be doable and accessible to sit with the patient and do all those communication to figure out if they need such kind of service or not.
So to me, it's on the upfront work, depending on how you're interacting with them. Some of them can do, an upfront survey, depending on if they have access to things. Some of them, while they're sitting in the waiting room, can do certain assessments. And it's basically them helping to fill that out. And there's teams that can help support the clinicians around this, right? Making sure, hey, I understand this is a component. Let me get clarification on this assessment from you, or just being able to even have them fill that out, because it is kind of like a questionnaire from the front point. So it's creating that team environment around you, as well as making sure administration or even the office staff, let's say if there's in a clinic, that they are starting to work towards community awareness, community resources that are available, that kind of stuff. It's not a one-stop shop, and it's not something that overnight you can just get up and running. It's a process, and I would say it's a continuous process to make sure that you know what resources are available in your community, and it shouldn't just be left on the RNs and the doctors.
Yeah, I can see one of the options to find those admins or team as a surveyor to come and help and assist the clinician. I want to be that bad guy and tell you still we have shortage, and this is
Mm-hmm.
additional cost for us to
Mm-hmm.
hire those or to
Mm-hmm.
allocate those. We are struggling with our finance, we are struggling with our budget, we are struggling with our team, and this is
Mm-hmm.
additional let's say, admin work, paperwork, whatever. So, what you will say?
Well, for some of this is maybe it's not the right time then. This is you can do a call to action to the community and see what their response is of what resources are available and see if there's an easier way to bridge it. But just taking it one step at a time. They do say, though, that prevention, every dollar spent towards it is basically, 3 to 5 fold in return. So trying to do the best for your patients and get ahead of things instead of reacting is an important piece for the service, right? So it's taking it in small strides and seeing what you can do. You can look at it from ask for support within the hospital at the analytics level. Even what's your population of patients that you're seeing, let's say at a specific clinic. What are the main issues that are coming up and barriers, and then see if there's an action plan around it. I would take it in smaller chunks so it doesn't seem overwhelming, and also maybe reach out to the community as a call for action and see how they respond with, here's the resources that we know.
Okay, from your experience and from your community where you work, and you have those system you work together to implement the affordable co-living.
Mhm.
So, what sparked them to take the first and initiate first step in order to implement this solution? From your experience, you don't need to mention names, but at least what motivated them to start?
What motivated the hospitals to start or myself? Sorry, just
The
clarifying.
hospital, the
Okay.
healthcare system.
So basically, from my standpoint, it's all about being proactive, right? Knowing that there's more than what we can handle right now, but how do we get ahead of this so that we can help them sooner, right? It's working upstream. So I think the motivator really is knowing that if you feel like you're drinking from a faucet, that you need a different way of handling it, and working upstream is important, as I call it. And then that's kind of the motivator, and also seeing that the patients keep on getting sicker and sicker and sicker, and there's more demands on the system. So how can we help the community to help themselves in a way? So it's creating more of a community-led approach rather than isolating into the hospital. It takes time, it's a strategy, and then it leads into a plan over time.
Yeah, I believe that this is need sometimes, and to see the result, and very hard for decision makers sometimes to get buy-in for something as a prevention, because the return of investment is very hard to approve it, or sorry, or improve it and make those results tangible. So, Jennifer, thank you for your time. Looking ahead, where do you see affordable co-living going on the next 5, 10 years? And maybe sometime we can re-invite you and share with
Mhm.
us some result and success story from your end. And I believe every state in the US, they have their own system there. However, it's a little bit different. I am here in Canada, we have
Right.
different approach, but for sure, thinking about prevention, it is the key. And this is where both of us, we connected with Athena for our community to build this awareness. And thank you to give me the opportunity of having you today with us and give us that understanding about co-living. To be honest, I learn a lot from you, and every day I keep learning from your experience, and start to see the good things, how clinician and non-clinician, they can work together to improve our healthcare system.
Yeah, thank you. Thank you for this time, and just starting to educate people and understanding if there's other options. Like you can even get in on investments, right? You could do it yourself and set up the trail if it's not available in your community. Yes, it would be a side passion project in a way, but that's one way. I've seen other organizations, I would say there's a few across the US that have been working on these barriers and working with their community led initiatives to help through food insecurities as well as housing insecurities. It's not it's starting to become a little bit of a trend in a good way. Whether you're in Minnesota, there's a couple organizations, there's a couple in California, there's one in Florida. So there's a few organizations. It's just looking and finding them. And that's what we try to do in Xena Health, like you were saying, how we met with Athena and others, is basically sharing those wins and who is working on initiatives around social determinants of health and how they evolved into that, right? And trying to get that awareness out there. So I feel like I'm going to continue down this path. I feel I'm going to start investing even more, and I'm looking at different states to do that in, depending on their laws and the access point, because there's some states that are suffering more than others. And just keep on spreading the word, right? And doing what I can to promote this. It's one of my passions. I have many things around prevention, but it's one way that I feel like I can help. And I do see the trajectory starting to take on. So co-living is starting to become a little bit of more people are hearing about it, I would say. And so this is exciting to me. And I want to make sure I can link it back into prevention strategies.
Me too. I'm very excited about that, and I'm very positive of having someone like you and Athena. This is will be happen, and we will can see the reflect later on. Maybe it's not in our generation, the other generation, but thankfully we have a talent and big brain like you and Athena, and this is recorded. So we agreed, me and Jennifer, to do that recording, but in the same time we'll open the Q&A. If you have any question, please put it on the chat or contact us directly, and Jennifer for sure will be available and will answer all those questions. I believe there's a lot of the questions here and there, and we as a clinician, we keep ourselves with the system, and the system put us on the box, and we know that this is something basic, but day to day we find ourselves hard and struggle to implement what we thought and what we believe on it. So having Jennifer and Athena, they keep encouraging us. We need to do that, and yes, we have. Jennifer, thank you for your time. I'm looking forward to see you again and share some of numbers, statistic, good story, and
Yes, thank you. Thank you for the time. And I look forward to sharing some numbers as soon as we create this ripple effect. Thank you. Bye bye.